What we're presenting at the European Breast Cancer Conference are the results from the AI modeling of lymphedema following breast surgery and radiotherapy, which was led by our collaborator, Dr. Guido Bologna, in Switzerland. And we want to use an AI model to better identify patients at risk of side effects from breast surgery and radiotherapy. And patients have told us that a significant side effect is chronic swelling of the arm, which is called arm lymphedema, and that it can affect up to a quarter of patients after either axillary dissection, which is a surgery, or local regional node irradiation, so radiotherapy outside the breast, which is in the node in the armpit nodes or the nodes above the clavicle. And so we would like to, because patients are at breast cancer is now thankfully a high surviving cancer, with about 80% of patients in Europe surviving 10 years or longer. We want to give the opportunity to those patients and their physicians to make some informed decisions around treatment with regards to paying attention to their risk of side effects. And the AI tool that we've developed is the one that we're presenting in Milan this week, is the one based on just 32 very common treatment and patient parameters that we can collect from patients in day-to-day practice. And that has with an overall accuracy of about 73%, can identify patients who are at high risk versus those who are not at risk of arm lymphedema. And it's using a type of machine learning, a type of AI which is called explainable AI, which gives you outputs for each patient that it makes a prediction for. The model was trained on large European data sets and French data sets of breast cancer patients undergoing surgery and radiotherapy with or without chemotherapy, and therefore we hope that the model is reliable. And this model gives out these predictions with associated explanations, so that the physician and the patient in clinic, when they get their prediction, can understand why they are at high risk and why the prediction was made, because it gives you an output which highlights the features in that particular patient, that were important in assigning that risk that it makes the prediction for. We hope to improve the accuracy of this model further by adding some imaging and imaging markers from radiomics, so the details of the patient's radiotherapy plan and scan, and also genomic features from the patient's germline, which we have data on from those cohorts. So in future, that should hopefully improve the accuracy of the prediction and the sensitivity and the specificity and the other parameters. But the plan is to use this model, the AI model, in a prospective randomized clinical trial, which will start later on this year in 3 European countries. In France, it will be led by Sofia Rivera, who's a radiation oncologist at Gustave Roussy, who will be leading this study, the chief investigator, and my colleague also, Caroline Verhoeven at Maastro in the Netherlands at the Maastricht Clinic, medical center, who will be leading this study to looking at using this AI model in patients and randomizing them to receiving the information of the prediction or not, and then depending on the prediction that they receive, the patients are at higher risk to using an arm sleeve, a preventative arm sleeve, wearing that for 3 months. From the start of their radiotherapy, to see if that has an impact on the reduction, to answer the question whether that actually works in practice. So it is this is part of a nice European multidisciplinary collaboration which seeks to bring AI for cancer patients into clinical practice. So this is real-world data sets from prospective cohort studies. This is not trial data that we use to develop these models. These are real-world data sets from 3 European from French and European observational studies. And while the incidence of lymphedema, of significant lymphedema in the data set, was only 6%, the AI tool was able to correctly predict lymphedema in an average of almost 82% of cases. So even using very commonly collected parameters of treatment and patient parameters from about their radiotherapy, their surgery, about their body weight, the patient's age, for example, it was able to perform this well, and both in the test and training data set. And obviously, and the patients that are at risk of arm swelling could then be offered additional measures based on this prediction. And we will use, and as I said earlier, we will use these results to take them forward in the clinical trial to randomize patients to receiving this information, or to show whether this actually makes a difference in clinical practice eventually. Yes, so I think the only thing to add is really if you are a centre in the participating countries, which, as I said, was either the France, Netherlands, or the UK, then please contact us, and we would be happy to talk to you about whether you want to take part in this trial. And we look forward to collaborating with you and your centre, because we need about approximately 780 patients to take part in this clinical trial, with a follow-up period of up to 2 years. And so we need as many patients as possible with an indication for local regional irradiation of their lymph after breast cancer to take part.